It is often overwhelming to try and cope with the stressors and the anxiety and the depression that come from trying to fit all of our roles and responsibilities into one 24-hour day. It is okay to ask for help. After all, isn't help what you've been trying to get your elderly loved one to accept? Again, thank you so much for allowing me to talk to you about this very important community and family issue. Thank you.
Thanks, Danette. I came with some questions of people have supplied questions to me, and I was glad that we have a few minutes left over today so I can go over some of these questions with you. I had someone ask me the question about her mom being very agitated most of the time. She claimed that she was a very sweet lady before she came down with Alzheimer's. What can her daughter do to help her, and is this normal?
One of the things that happens in early to mid-stage Alzheimer's is a distinct change in personality. So I can certainly understand why she would seem to not even be the same mother anymore. Her daughter needs to be patient. She needs very much to seek professional help. She needs to love her mother, give her lots of hugs, and help her understand that she knows that her brain is not working the same way that it did, but that together they're going to get through this.
Okay. Another question is, another person had reported that when they go to their parents' home that used to be so immaculate, they see their parents' house a mess, so they see that their grooming has fallen down, they're not keeping up with her hygiene. Do they need to move out of their house? Do they need to start looking for some sort of placement for them? Or what are some alternatives to that?
One of the things that I forgot to mention earlier is when an elderly couple is living together, sometimes if one or more of them have dementia, there can be abuse. Not necessarily the husband to the wife. Sometimes it can be the other way around. So the family member needs to look for signs of abuse, such as excessive bruises or one person seeming to be fearful of the other one. I did want to mention that. As far as the house goes, it sounds like housekeeping has kind of gone out the window, and it probably is time to help them find a safer place to live that will offer them some assistance in the things that they need to get through the day, such as cooking, cleaning, laundry, that kind of thing.
Okay. Another person asked me about her mom's sleep pattern. Suddenly she'll go for days with little to no sleep, and she's worried that this is affecting her health. Is it normal for the elderly to not get as much sleep?
The elderly do sleep less. However, they do sleep. So this could be sundowning, which is an elderly person with dementia sleeping less at night or not at all at night, and being very confused at night and staying up in the daytime, or still sleeping part of the day away also.
I wanted to say a little bit about finding placement for the elderly. I remember when my mom, who has passed on now, I remember that when she started getting dementia, that some of the same things that we've talked about were symptoms that she exhibited as well. And we were very concerned about putting her in a nursing home because we knew she did not want to go to a nursing.
Absolutely.
We had to put her in a nursing home briefly when she had to get rehabilitation for a broken shoulder and a broken hip. And while she was there, she did not want to be there and was called. They were calling me every day, please come and talk to your mom.
Right.
So one of the things that we